thank you all very much. 3 fascinating talks there. So what we could do now is just get the thoughts of Phil on things that we've heard this afternoon. So from the PPIE voice. Phil, you've been listening to these talks this afternoon. Do you want to say a few words about what you've thought about?
Absolutely. I cannot say how much I've been inspired by them. To characterize just a tiny bit, I'm involved in lots of PPI projects where typically a researcher has fixed absolutely everything about the project, except they realize they need some PPI by next Friday in order to be able to get the research through. And the PPI comes from a small group of middle class, often retired medical people. And we sit around and we ask ourselves how we can widen the circle and reach more people, but we probably don't do it very effectively. So I think all 3 projects have been an inspiration in terms of involving whatever we call them, service users. I call them punters, patients, right from the beginning, and building it into the fabric of the project. So yeah, all 3 of them I think have been an inspiration to me.
Thanks very much, Phil. Well, let's open the floor for general discussion on that. And just to kick things off, do you think that part of our collective work should be to embed this in some way more deeply from the NHS side? Because I think a lot of us involved in this kind of work have goals that relate to mental health services and treatments and outcomes there. But sometimes the recruitment process and the engagement process sits a bit outside that. And Phil, you've described very eloquently what sometimes happens if you don't do it perhaps very well, and you get a kind of cohort of people who have a particular interest and time for that. And a number of you have spoken about those underserved communities and the risk of bias in who you recruit to advise your studies, which presumably then carries the risk that you end up with a non-representative view overall. What do you all think are the best ways to try and make that representative of people using, for example, NHS services? Iona, perhaps we'll start with you.
I think that's not an easy question, and I think my answer to that is going to be to do lots of things, different things simultaneously, because I think each one of the methods that's been described today and different methods that you can come across will capture different people. And I think when you're talking about underserved audiences, there's not going to be a one size fits all. It's going to be a bit of one, a bit of another. It's really trying to get to know that audience and what works for them. But I think it's probably combining lots of different approaches together.
Kerry, sorry, Zara. I'm looking at your name label for the constantly.
Zara. No problem. We actually use, I don't know if Pauline wants to add anything as well as I go on, but we actually used a really new way of recruiting people, where we use a recruitment agency actually to get our 200 participants. And we specified that we wanted, all of these different areas like gender, ethnicity, educational attainment, geographical location. We specified all of these things prior to them, and we actually ended up getting a lot of people and a really, really broad range and really diverse group. And I think it's actually been like a really positive experience of recruitment for us and in the study, and it meant that we got really rich data, and it was a really useful way of recruiting actually. So
and do you have sort of insight into what they do behind the scenes? How do they achieve that representative sample?
I might have to ask Pauline if she has any more information on that.
They haven't disclosed their methods to us.
No. I think they do use some advertising online, but we also recruited people who've been in contact with their GP for physical health issues in the last kind of 3 to 6 months. So I do assume that they have some kind of connection with NHS services. I think that was one of the requirements that we had.
Right, yeah, because we ran a online study last year across the UK, and was sort of so we got information on the bias that happened, that you sort of produced spontaneously, and it was a mixture of kind of public advertising and NHS-based advertising, but there were very clear gender biases, ethnic biases, postcode-based deprivation biases, and to some extent you can sort of do statistical things to correct for it, but it was some of them were quite striking, and I think Facebook and so on, they offer some geography-based targeting. So I don't know if that's what the recruitment agencies do, but it is a very tricky problem. I just wonder if we should be doing things in NHS services to get people to sign up for participation in research design or this sort of work. Simon, do you want to comment?
I think that's a really good idea. I think sort of more generally, some of the feedback that we received from our own PPIE was that the casual nature of being able to do things digitally, especially for young people, means that the engagement could be higher, and that perhaps in future, once we're kind of post-pandemic, running things in a physical and in a digital setting alongside each other may be a way to broaden that as much as possible, and in a variety of different ways, whether that's through Facebook or apps or however we wish to do this. But yeah, the feedback we had from younger people in particular was that the sort of taking away the travel costs that are involved and the effort of having to attend somewhere and being able to answer polls and other bits of information, kind of, whether lying in bed or on their way to college or whatever, is that casual involvement means that there'll be greater participation as a result, because it's making it easier for people, and removing those physical barriers can be advantageous.
Yeah, thank you. There's a question from Eileen Hare about, I think it's about the app, Manchester app, I think all of that, whether it's vulnerable to abuse. And I guess I don't know if Eileen's got a microphone, but perhaps Chris will also sort of think about that more broadly, about, I suppose, that there's the anonymity side, but also potential for disclosure through the app, or whether indeed is there some risk that people who have a very strong view about one of the studies organize a campaign and you get unverified large numbers of responses, particular viewpoint or something like that. Pauline?
Yeah, it's an interesting question. I think we need to think about what vulnerabilities are there. I guess the first stage, as we mentioned, was to go through, we're taking on studies that are NIHR approved in the first place, and we have our own ethical advisory board to review them again. And I suppose in terms of anonymity, we comply with all the relevant standards around data security and confidentiality. So I think we've got that covered. In terms of people maybe posting something as feedback in the app, only the research team can see those. So it's not that would go out to all the other people using it, in terms of actual free text content wouldn't be going out to all the other participants. So I think that protects that one. In terms of maybe organizing a campaign, I'm not sure that's any different to face-to-face activities. I suppose if somebody was upset about something, and maybe they'd have legitimate cause to do so, so that might actually be a good thing. But I don't know about vulnerabilities. I can't think of any other things that we kind of haven't covered at the moment. But if anybody does think of anything that we haven't, please let us know. We're still developing this, so all feedback very welcome.
Thank you very much. And another question on the chat here from Sarah Chano. So to what extent are the barriers to good PPIE due to technology obstacles, the need for more PPIE volunteers, or due to the need for meaningful relationships to develop between researchers and the people affected by the research? Zara, do you know?
I think I can comment on the technical barriers, as we've done kind of this extensive PPI engagement with members of the public, that we definitely did find that there were some kind of technical barriers, particularly for older people or for people who weren't necessarily working on computers or didn't have computers and were logging in on their phones or iPads and things like that. So we did have some issues in the consent process, particularly sending off documents and then getting them back, and then a lot of the kind of anxiety around using digital technology as well. I do think there are still some barriers to digital tech and PPI activities. A lot of the time, a lot of it could be solved by picking up the phone and speaking to people and kind of building that relationship then. So you're not just the person at the end of an email, and you can help people in that way. But yeah, I do still think, I mean, people have been kind of flung into it this year because of COVID. So I think a lot of people who may not have been using tech anyway have kind of started to use it more in the past year or two. But there definitely still are some barriers. And I do think there might be some groups that you will end up kind of missing or just slowly edging out maybe a bit with kind of moving on to very heavy digital tech PPI activities. I'm not sure if that answers the question, but I think it does.
Phil, you want to comment on that?
I might have missed this, sorry. I might have missed this, but using the online apps, is it essential that people use their own name, or can they use, usernames, anonymous usernames? I wonder if it makes it easier being able to be anonymous.
Yeah, so at the moment you can use the app and you don't need to enter your personal details. That's absolutely fine. If people prefer to do that, that's fine, yeah.
Iona?
Yeah, to answer that particular question, people use their Facebook profile. Most people do use their own name on their Facebook, but they can change it. Not everybody decides to use their own name. It is up to them. Going back to the previous point, something that came up in our discussions was the kind of project-based nature of research, and the public participants didn't really understand that and didn't appreciate that people might kind of come and go and disappear because a project might run for 2 years or 5 years. They would much prefer a steady group that they could get involved with. If we want long-term participation from them, they would like a steady long-term participation from us. So it's looking perhaps at how we can maintain those as projects come and go. How do we maintain the same PPIE groups or apps or whatever it is with some level of longevity or some looking to the future?
Okay. And can I just also ask you talked, Iona, about the fact that despite the fact that ethics committees often want to see PPIE work going into ethics applications, that you had a lot of difficulty getting a PPIE project through ethics because it was a bit unfamiliar to them. How have you managed to change their mind and change their processes?
I think part of it was that we just didn't fit in any of the boxes, and so we've had to sort of go through these processes. I think in some ways it's me wearing them down because I keep applying for ethics for my projects and I keep not fitting in the boxes, and so they're looking, and then there's other people watching what I'm doing and thinking, actually, does my PPIE or does my public engagement need ethical approval? And maybe it does, and if it does, then how are we going to address that? So there's also outside people thinking, hang on a minute, if you're doing public engagement and needing ethical approval, maybe I do too. And so the call for it is rising, and if we don't sort out these forms and don't sort out these processes, they're just going to end up with a whole pile of people they have to address individually, as opposed to setting up a system that would actually deal with it and help with it.
Yeah. Was that NHS ethics or university ethics?
This is university ethics. This is college level at university ethics.
Right.
I haven't dealt with NHS ethics quite yet, I'm afraid.
I was just wondering whether
that's a future one to tackle.
wondering whether the kind of challenge was this doesn't need ethics or this needs ethics, but it's the wrong sort of thing.
Yeah, so NHS ethics said we don't need ethics like for these particular projects, but university ethics felt that we did because we're dealing with potentially vulnerable groups of people.
Yeah. Thank Any other questions from the chat or live, or any other comments anyone wants to make? Okay. Otherwise, we should finish a few seconds early to allow the next session to start on time. Thank you all very much for a fantastic set of talks there. And thank you, Phil, as well, also for your comments.
Thanks for inviting me.
Much appreciated. I shall hand back to Sarah now before the next session.